My name is Madison Stubbs, and in this anatomy assignment, I'll be doing a presentation about the musculoskeletal system. This system is the work of muscles and bones within the human body so that movement is produced. In this PowerPoint, I'll be talking about the functions of the skeletal system first, so the 6 different purposes of the skeletal system being in the body. Then I'll go into the structure of the skeletal system, including all the major bones in the body and where they are located. Then I'll be looking at the classification of bones, so the type of bones that make up the skeletal system. Then finally I'll move on to the muscular system, so the location, origin, insertion and actions of all the major muscles in the body. The human body is made up of 206 bones that form the skeleton. Although we are born with 300 bones, some are fused together to form longer and stronger bones which aren't fully grown until 23 years of age. Bones are at the strongest at 30. They are attached to muscles, tendons, ligaments, and joints, which all work together to produce movement. The skeletal system has 6 functions to aid the work of the human body: support, storage, protection, attachment, bone growth, and blood production. Support gives shape, stability, and the body a platform to stay upright, as well as aiding the vital organs. The framework of the skeleton causes this support, such as the lower limb supporting the torso. Storage is of minerals that are reserved in the bones, such as calcium and vitamin D, that can be released into the bloodstream when they are needed by the body. The mineral stores are important as they are used for bone growth and strengthening. Protection is for securing the vital organs, which are extremely delicate compared to muscles and bones, such as the brain, from damage, as well as the spinal cord. Attachment is the bones being connected to muscles by tendons to form levers which produce movement. Movement is enabled by joint movements and muscle contractions. Bone growth is for strengthening bones when they become brittle. Although bones stop growing at the age of 23, they still need to be strengthened, and this is caused by osteoblasts, osteoclasts, and the epiphyseal plate within the bones. Osteoclasts are cells which remove bone by absorbing the calcium and destructing bone cells, whereas osteoblasts rebuild the bone cells to create new bone tissue. The epiphyseal plate generates new cells in order for bone strengthening process to continue. However, if the bones become too brittle, osteoporosis occurs, which is caused by the osteoblasts not working. This can be solved by weight-bearing exercises taking place, such as running, to put stress on the bones due to impact and muscle pull. Blood production is caused by the bone marrow within the bones producing red blood cells. Most of the red blood cell production happens within the sternum, pelvis, and vertebrae. Within the skeletal system there are 2 parts, axial skeleton and the appendicular skeleton. The axial skeleton is made up of the centre line bones of the body and is for support and protection. The bones in the axial skeleton include the cranium, which protects the brain, the rib cage, which protects the heart and lungs, the sternum, and the vertebral column. The vertebral column protects the spinal cord and consists of 33 vertebrae divided into 5 categories: the cervical, thoracic, lumbar, sacrum, and coccyx. The cervical section has 7 vertebrae and is at the top to support the head and neck. The thoracic section has 12 vertebrae and is connected to the ribs. The lumbar section has 5 vertebrae and allows movement of the torso. The sacrum section also has 5 vertebrae and is connected to the pelvic girdle. The coccyx section has 4 vertebrae and the remains of an evolutionary tail. All these vertebrae cause there to be many different spinal defects that can occur, the main ones being kyphosis, scoliosis, and lordosis. Kyphosis is the exaggerated curvature of the spine, causing a hunchback. Scoliosis is the abnormal curvature of a spine, forming a C or S shape. Lordosis is the excess inwards curvature of the spine that causes the bottom to stick out. The appendicular skeleton is mostly for movement and consists of the upper and lower limbs, shoulders, and pelvis. The bones that are included in the appendicular skeleton are the humerus, which is located in the upper arm, the radius and ulna, which are located in the forearm, the carpals, metacarpals, and phalanges, which are all situated in the hand. All these bones are in the upper limbs. Also, the femur, patella, known as the knee, tibia, fibula, tarsals, metatarsals, and phalanges, which are all located in the lower limbs. The clavicle, known as the shoulder bone, the collarbone, and the scapula are all in the shoulder. Also, the ilium, the pubis, and the ischium, which are all in the pelvis. There are many different classifications of bones within the human body, including long, short, irregular, flat, and sesamoid. Although these bones have different structures, they are all made up of two types of bone, spongy and compact. Spongy bone is the inner part of the bone, either found at the end or centre of bones, which is lightweight and acts as a shock absorber, whereas the compact bone is the dense outer part that has a smooth appearance. Long bones have greater length and width. They have a different structure to the other bones within the body. Long bones include all the limb bones apart from the patella, tarsals and carpals, and the clavicle. Short bones are small cube-shaped bones that are made of spongy bone in the centre and a layer of compact bone on the outside. Short bones include the tarsals and carpals. Irregular bones are complex shapes that consist of spongy bones encased in a layer of compact bone, the same as short bones. Irregular bones are the vertebral column and mandible, known as the jawbone. Flat bones are slightly curved and thin. The bone is made up of spongy bone inside of two layers of compact bone. Flat bones are the sternum, ribs, cranium, scapula, and ilium. Finally, the sesamoid bones. These have the same structure as short bones but are unique as they are able to move, vary in size, and are attached to tendons. They are also covered in a layer of cartilage due to being where a joint is formed. Sesamoid bones are the patella and metatarsals. In order for movement to occur, bones need to be connected to muscles. Muscles pull against one another and cross at least one joint for actions to happen. All the following muscles are skeletal muscles. They are all joined to the skeleton by tendons. This means they are voluntary muscles that are made to contract and relax to produce movement. These muscles all have a location, origin, insertion, and action. The origin is where the muscle attaches and is fixed. These are usually immovable bones. And the insertion is where the muscle attaches and moves a joint, usually a movable bone. Muscles in the arm include the bicep, tricep, and deltoid. Bicep is located in the anterior side of the upper arm. Its origin is the scapula, and its insertion is the radius and ulna, and its action is flexion at the elbow. Tricep is located in the posterior side of the upper arm. Its origin is the scapula humerus, and its insertion is the ulna. The action is the extension of the elbow. Deltoid is located on the outside of the shoulder. Its origin is the clavicle, its insertion is the humerus, and its action is abduction of the upper arm. Muscles in the back include the trapezius, latissimus dorsi, rhombus, teres major, and erectus spinae. The trapezius is located on the posterior side of the upper arm, of the upper back. Its origin is the thoracic and scapular vertebrae. Its insertion is the clavicle and scapula, and its action is elevation of the shoulders. The latissimus dorsi is located on the posterior side of the ribcage, known as the thoracic cavity. Its origin is the lumbar and the sacral vertebrae. Its insertion is the medial side of the upper humerus, and its action is abduction, extension, and rotation of the shoulder. The rhombus is located on the posterior side of the ribcage. Its origin is thoracic 2 to thoracic 5 vertebrae. Its insertion is the medial of the scapula, and its action is protraction and rotation. The teres major is located between the scapula and humerus. Its origin is the lateral and inferior angle of the scapula. Its insertion is the medial side of the upper humerus, and its action is rotation and abduction of the humerus. Erectus spinae is located along the side of the vertebral column. Its origin is the sacrum vertebrae. Its insertion is the ribcage, cervical, and thoracic vertebrae, and its action is extension of the back. Muscles in the anterior side of the axial skeleton include the pectoralis major, external obliges, and rectus abdominis. The pectoralis major is located on the anterior side of the rib cage. Its origin is the clavicle and sternum. Its insertion is the anterior side of the upper humerus, and its action is flexion and extension of the upper arm. External obliges is located in the lateral side of the trunk. Its origin is along the lateral ribs. Its insertion is the pubis and abdominals, and its action is lateral flexion and rotation of the trunk. Rectus abdominis is located on the anterior side of the trunk. Its origin is the pubic crest, and its insertion is the rib cage. Its action is flexion of the lumbar spine. Muscles in the leg include the quadricep, hamstring, gluteus maximus, gastrocnemius, and tibialis anterior. The quadricep is divided into 4 areas: the vastus intermedius, vastus lateralis, and vastus medialis. Its location is anterior side of the femur. Its origin is anterior of the femur. Its insertion is attaches to the knee, and its action is extension at the knee. The final quadricep is the rectus femoris, which is a little different to the rest. Its origin is it attaches to the pelvis. Its insertion is that it moves the hip, and that its action is flexion at the hip. Hamstrings, there are 3 in the leg: the bicep femoris, the semitendinosus, and the semimembranous. Its location is the posterior side of the femur. Its origin is the ilium. Its insertion is the tibia and fibula, and its action is flexion at the knee and extension at the hip. The gluteus maximus is located at the posterior side of the hip. Its origin is the ilium and sacrum vertebrae. Its insertion is the posterior side and top of the femur, and its action is extension and lateral rotation of the hip. The gastrocnemius is located on the posterior side of the tibia and fibula. Its origin is the posterior side of the femur, and its insertion is the heel, known as the calcaneus, and its action is plantar flexion. And finally, the tibius anterior is located on the anterior side of the fibula. Its origin is the top of the tibia, and its insertion is the metatarsals, and its action is dorsiflexion.